Hey everyone, ignore my mouth, it's blue. I was drinking ocean water drink packet. So I just wanted to show you, this is my growth hormone. I was going to give you guys show y'all how I do it. This is not how everyone does it. And yes, I'm wearing the same shirt as yesterday. I just woke up. I haven't showered or changed yet. No judgment. This is how I do it. I don't need to do that yet. Okay. Just open it up. This packet comes with a needle and my medicine. I don't like this needle, so I don't use it. I use this one because the needle width, I don't know how to explain it. The size of the needle is different. Let's take this part off. And you expose the needle part. This is growth hormone for people who need this as medicine. I have osteoporosis, so that's why I take this. So people take it to grow. I'm 32, so I don't need it to grow. This is just the medicine all done up. This is my dose. Okay. Do this. And then we rub this on. I'm doing this side today. I try to switch sides so it doesn't scar up and look nasty. Then you take the cap off and expose the other needle, and you just poke it into your skin and slowly inject the medicine. Then you take it out. I would normally put the needle in my sharps box and the rest in the trash, but I'm not gonna do that with y'all. Give me 1 second while I dispose of all of this properly. Okay. So we want to do the heart monitor like right here. Let's see. We don't want to use the acrylic slip slides. So we need to find all the acrylic ones, because we don't want to use those for our skin because we have sensitive skin. Okay. We gotta charge this up. As you can tell, it's frustrating. Let's do it over here. Boom, the phone for the study. Okay, I think we take this off. They're right there. It's 85%, so it doesn't even need charge. Where is the power button? Button. Oh, right here. See, it's gonna power all the way up. Now, I wanna know. How do you charge your thingies? Oh my god. It's a phone charger. Oh, okay. So this is the other charger. So you would. This is 2. Boom. Connect that one to the charger. The one you wear would be this one. And you just power on. I don't know what. See, it's gonna give me this error. Poor skin contact because I'm not wearing it. So if I press the button, it's gonna tell me that the monitor is securely. Make sure that the monitor is securely attached to the USB connector. Body Guardian is security adhered to your skin. Body Guardian is positioned properly on your chest. Okay. So when I want to start the study, I hit finish. It's gonna keep telling me I have poor skin contact. We can put the acrylic ones all back in the box because we won't be needing those. Excuse me. We want to make sure we're using the hydrocolloid one. Okay. Okay, well, I don't want to use those. How do we take this? Okay. Before we do that, we need to sanitize the skin. With this. Now, we're going to try and show you how I do this the best way that I can. We're going to wipe the whole area, even in between, because it gets in there. It gets in your face. We're not even going to talk about that. This is a lot. You know what I'm saying? Like, people just don't understand. This is a lot. It wears on the soul. This is just undoing that. And it's just this strip. They say to wear it this way, or like this way. This way is the most effective, but the last time I did it that way, it worked my skin off And I'm not putting my girls through that again. We done been through enough. Okay? Okay. So we're going to put this right here. Okay. See, it has good contact with the skin. It's in the right area. Boom. Okay, then we put this boom in here. Now I can start my study. And it says to keep the phone within 10 feet of you. So if I go to the bathroom, gotta bring this phone with me. If I go downstairs to get something to eat, I gotta bring this phone with me. You know what I'm saying? So it's a lot. It's a lot. Because on top of bringing my regular phone with me, you know what I'm saying? So, anyways, I know this was a video of me showing y'all everything. But, one, that's how you know you did it correctly. Because it's still on the screen and it's not showing the whatever. But I don't know, like people go through a lot with medical tests and with procedures and stuff. We go through a lot. Heart monitor, 30 days. I've had at least 3 MRIs, 2 table tests, a million things of blood work, about to be 2 echocardiograms. I did a heart monitor before. I did an EEG in the hospital and at home. I've done like a million tests to try to figure out what it is. And they're like, we don't know. Oh, okay. So yeah, I just gotta make sure that I keep this on me. Because if this one isn't on me, this one's gonna be on me for the next 30 days. Change the strip. It can be changed out every... I would suggest doing it 3 to 4 days. Because otherwise it can irritate your skin really bad. Not to mention that, but I'm literally just sitting here. We're just gonna let it have its poor skin contact, because as y'all can see, this is correctly adhered to the skin. But anyways, like I was saying, it's just, as someone who struggles with a lot of medical issues, you just have to walk through life different. You know what I'm saying? I may look like a normal person, but I have a lot going on. medical wise and mental health wise. Just make sure that you're taking care of yourself, because even if it's hard to keep struggling with the doctors, it's better than just saying forget it. Because for the longest I was scared I have cancer, because I just started quitting smoking January 1st, 2024, and I've smoked for 17 years and it's terrible. But you know what I'm saying? It's the fear. You smoke long enough, eventually you kind of just get used to the fact that it's cancer. So every time they do an echocardiogram or MRI or whatever, it's good, because it lets me know I don't have a tumor in my heart. I don't have any in my brain. You know what I'm saying? And I just went in for nosebleeds and they stuck that long thing up my nose, so I don't have any in my nose. What was I gonna say? Please advocate for yourself when you go to these doctor's appointments. If you feel like something is wrong, or you know something is wrong, you have to push these doctors. You have to fight for yourself. You have to make suggestions. You have to do research. You have to suggest tests. You have to do all of that. Because y'all already seen what my hair look like, so this really isn't. What is going on here? Okay. You have to advocate for yourself. I can't say that enough. The minute you stop advocating for yourself is the minute the doctors slip through your fingers. And a lot of times they don't care. I don't know what happened to the medical industry after COVID, but even slightly before COVID. But they're just bad. You know, my mom's a doctor because I was born with health conditions. So they didn't want to just give me, because I was in a foster care system, to give me to anybody who can just handle me. You know what I'm saying? I could talk about a little bit more of that in another video, but my mom adopted me. She's actually the one who gave birth to me and saved my life. I mean, she didn't give birth to me, but she helped my mom give birth to me, and she saved my life because I was dying when I was born. We could talk all about that stuff in a different video, but it's just like, I grew up in her doctor's office. Not because I was always sick, which I was, but because, like, anytime I was off from school or stuff like that, and my mom wouldn't be home all day, she would just take me in the office with her. So I used to sit in her office, be in her waiting room, hang out with her nurses and stuff. And I'm not gonna lie, I had so much fun. But I also got more of an inside look with medical stuff. My mom has greatly helped with talking to doctors and figuring out how to speak their language. You know what I'm saying? Because if you get mad and you go off, they're going to shut down and not help you. And I have a bad temper. Something I need to work on. But, like I said, work in progress. But, you gotta be careful what you do with these doctors and what you say, because they will sometimes take that as a response and be like, oh, she's mad, she's going off. Okay, well, I'm not gonna go above and beyond for her. I'm not gonna go above and beyond for him. They, them, everyone, anyone. It's just so crazy. So you have to learn how to speak the language for these doctors and learn how to ask for certain things and say certain things and advocate for yourself. And if you need help with that, I can do the best I can. I don't know everything. Um, I can always ask my mom and I can get back with you guys. But make sure you comment and subscribe if you want more, I don't know, realness. Real medical channel, real whatever. If you want to see any of my games, let me know because I do play Sims and like Pokemon and other stuff. Just to try and occupy my time. If you want to see any of my slimes, let me know. Whew. And I'll let you guys know. You know what I'm saying? Like, and please advocate for yourselves and look for the silver lining in every day because you don't know if it's your last. Hopefully, it's not. Knock on wood. But you never know. Bye, y'all.